So patients that are presenting for breast augmentation will often present with very similar questions, and they'll often center on, what is the process? How does this work? Is this the right operation for me? And that's a major driver of the consultation is, some patients that think they're candidates for breast augmentation really might just need a lift or something like that, or maybe a combination of a lift and an augmentation. So first things first, is this the right operation to get me to my cosmetic goals? And assuming that it is, follow-up question that often comes with that is, what size do you want to be? What are your aesthetic goals in that regard, which often drives that consultation. There are many different ways to assess something like that for a patient that presents for breast augmentation, and may range from a surgeon just deciding kind of on their own, I really think this is the size that you should be for your aesthetic goals, to someone that may take some measurements in that clinic visit to help guide that decision. I would fall into that camp, along with using something more tangible, like a sizing system that we use in our office for patients that present for breast augmentation consultation, where it's literally kind of like a mock-up of different size implants that our manufacturer has designed, where a patient can just slip them into their clothing and see how they look in the mirror and try to get the aesthetic that they're looking for kind of in real time, and that can guide the decision in terms of, okay, what size implant is right for this patient. Beyond that, if it's breast augmentation or really any plastic surgery consultation, patients will often want to understand the recovery process. And for something like breast augmentation, it tends to be a lot easier than a lot of the operations that we do. The incision is small, the recovery tends to be pretty fast. That draws a lot of patients into an operation like that because the recovery tends to be pretty quick.